I think that there's a couple of things. One is that over time, I think the treatments for cervical cancer have got better. So the outcomes that we saw in this trial were actually better than expected. And we had about 2/3 of people who didn't develop relapse disease. So that made it harder to show a benefit of adjuvant chemotherapy. I think the other challenge is that we used carboplatin and paclitaxel, which is the best chemotherapy that we have to treat metastatic or relapsed cervical cancer. But we know that this only works really well in about 1/3 of patients. So perhaps we also need better systemic therapies to see a benefit. And the final challenge, I guess, was just being able to deliver the therapy. We found that a significant percentage of women didn't start the adjuvant chemotherapy, and we did see quite a lot of side effects. So challenges in delivering the regimen after women have already gone through 8 weeks of chemoradiation was also a challenge. So I think our results are very definitive in that giving adjuvant chemotherapy with carboplatin and paclitaxel doesn't help. It didn't improve overall survival or progression-free survival and just seemed to increase side effects. So I think that we shouldn't be using this type of adjuvant chemotherapy in this setting. There have been some, smaller previous trials suggesting a benefit, but they've been criticised methodologically, and this is a very large randomised trial, so I don't think that we should be giving adjuvant chemotherapy in this setting. That's not to say that we shouldn't be investigating other adjuvant therapies, because we know many of these women do unfortunately still relapse, so we still need to do more work on improving outcomes. There are a number of things being looked at and that we need to work on. Currently, there are a number of trials looking at the addition of adjuvant immunotherapy after chemoradiation, which is an approach that's been shown to be successful in other cancers like lung cancer. So it'll be very interesting to see if the same might apply in cervical cancer. But I think another important aspect is trying to get women through the standard treatment as well as we can, because we know from the OUTBACK trial that there were still women that struggled to complete the standard chemoradiation and had quite a lot of side effects during this treatment. So there are a number of endeavours also ongoing to try and improve things like, targeting the radiation better, whether we're better if we use IMRT to try and reduce the toxicity of the chemoradiation. The other thing is it's really important that we make sure that women have brachytherapy, which is an essential component of the chemoradiation. And we know that there's been a trend in some centres to not use the brachytherapy and instead do things like try and give an extra boost of radiation. And this is because it's hard to give the brachytherapy. It requires specialised equipment and training. So we need to make sure that all women have access to brachytherapy.